What are ORS scientific principles for child diarrhea? When we talk about treating diarrhea in children, one important tool is Oral Rehydration Solution, or ORS. But what makes ORS so effective? Let's dive into the scientific principles behind it. First, ORS works through a process called sodium-glucose co-transport. This means that when glucose, a type of sugar, is present in the ORS, it helps the body absorb sodium from the intestines. This is done through a special protein in our cells that transports both glucose and sodium together. When sodium is absorbed, water follows along, helping to rehydrate the body even when diarrhea is causing fluid loss. Next, we need to think about electrolytes. Diarrhea can lead to the loss of not just water but also important electrolytes like sodium and potassium. ORS contains a balanced mix of these electrolytes, including sodium chloride and potassium chloride. This balance is crucial to restore what the body has lost and to prevent complications like low potassium levels or acidosis, which is when the blood becomes too acidic. Another key aspect is osmolarity. The osmolarity of ORS is carefully designed to be around 245 to 300 milliosmoles per liter. This specific concentration helps maximize the absorption of fluids while minimizing the risk of causing more vomiting or diarrhea. Lower osmolarity solutions are generally safer and more effective for rehydration. Now, let's talk about how ORS promotes water absorption. By enhancing the absorption of sodium and glucose, ORS indirectly encourages water to move from the intestines into the bloodstream. This is vital for counteracting dehydration, especially in children who can lose a lot of fluids quickly. When it comes to practical use, ORS is easy to administer. It can be given orally, and the amount depends on the child's weight and how dehydrated they are. It is safe, affordable, and can be used at home or in healthcare settings. Research shows that using ORS can reduce the risk of death from diarrhea by up to 93% in children under 5 years old. Sometimes, zinc is added to the treatment plan alongside ORS. While zinc does not directly help with rehydration, it can reduce the duration and severity of diarrhea episodes, making it a helpful addition. In summary, ORS uses the body's natural sodium-glucose cotransport system to effectively rehydrate children suffering from diarrhea. By replacing lost fluids and electrolytes, it helps prevent severe dehydration and its serious consequences. This approach is backed by extensive research and is recommended by major health organizations around the world as the standard treatment for diarrhea in children. Always remember, if your child is experiencing diarrhea, it is important to consult with a healthcare professional for the best care.